Welcome to My Trialist Trial Talk, Voices of Experience.
My name is Joni Friel. I am 63 years old for a few more weeks. And I was diagnosed in September of 2016 with mantle cell lymphoma. Long story short, I ended up having open heart surgery. And before the surgery, they did a scan, just to look at everything. And it was during that scan that they found an innumerable amount of swollen lymph nodes in my abdomen. So I was told I had cancer, either leukemia or lymphoma. So my daughter found a local oncologist here for me, who sent me to a surgeon who removed a couple lymph nodes and told me that I had mantle cell lymphoma. When I first got diagnosed, my question to my oncologist when I found out what I actually had, what kind of cancer it was, I said, will I be alive 5 years from now? And he said, that's the plan.
How did you learn about clinical trials?
My boyfriend, who works in the medical field, did some research and found a doctor at MD Anderson that was diligently working for a cure for mantle cell lymphoma in particular. So I went down there for a second opinion, which my local oncologist was good with. And it was when I was there, a friend of mine drove me down, and it was there that I first even heard of a clinical trial.
How did you feel about clinical trials before enrolling in one?
I wasn't concerned about the clinical trial because I was told it was less toxic, which was one of my concerns, because you hear about these, people having a hard time with chemo and such. And the way, hoping for a cure, I figure, average life expectancy of 5 years, maybe a cure, and I chose to go for, maybe the cure, less toxic.
Why did you decide to enroll in a clinical trial?
Well, two reasons: less toxicity and no stem cell transplant. I had heard a little bit about stem cell transplants, and I wasn't real enthused about having one. That was one of the big decisions, and hoping for a cure, of course.
What was the clinical trial enrollment process like?
I had to go through a battery of tests at MD Anderson, but everything was okay, and I did qualify for it, and thankfully my insurance approved it right away. So I did not have any issues as far as qualifying for it. It was hard going through when the nurse comes in and tells you all the possible side effects and all of that. But they were both, I went through it locally and at MD Anderson, and you can imagine what the possible side effects are. The test I went through at MD Anderson, well, I had already had the biopsies, and they took those. I had to have a colonoscopy, and they discovered that the cancer was in my upper and lower intestine. Bone marrow biopsy. I had a bone marrow biopsy, of course, battery of blood tests. I think that is all the tests I had to qualify. I can't remember if I had my first PET scan there or locally or at MD Anderson, but I had a PET scan after I was diagnosed, and it confirmed it was mantle cell lymphoma.
Did you face any barriers when deciding to enroll in the trial?
Finances are a concern. They're still a concern. Credentialed, my insurance, my work insurance company, which I'm still on disability, they decided that I should be able to go back to work, even not even listening to their own neurologist. So I had to get an attorney, So now the attorney keeps like $577 a month of my already lowered income. So finances for cancer patients, a lot of cancer patients is a real issue. I see that because I'm on support pages. MD Anderson's about 4 hours away. During the treatment, you're hospitalized, and my mom could actually, they had areas so she could actually stay in the room with me. When you're going down for testing and follow-up appointments, you have to get a hotel. All of that gets expensive.
How did your family, friends, and community react when you told them you were enrolling in a clinical trial?
My family and friends were behind me. When I had my doctor's appointments, I never went by myself, and I would always dial in. You know how you can three-way call, I'd call my brother, who'd call someone else, who'd call, so it's almost like it was a family ordeal at my appointments. So they were involved in the decisions right along with me.
Can you tell us about your clinical trial experience?
For the first 4 weeks, I went for a Rituxan infusion once a week down to MD Anderson. It took about 4 hours for the treatment. And then after that, you started Rituxan once a month, but we were on ibrutinib every day. It's a pill that you take, and you had to do that until you were in remission. So after 4 months, I reached remission, and then I had the R-hyper CVAD, and that's the chemo that was too harsh for me. I had that in February, March, and April, and then I got sepsis, and my heart had been acting up during the chemo treatments. And my oncologist at MD Anderson wanted to stop the treatments. And they work as a team. The team got together and decided that they should give me a reduced dose of our hyper-CVAD. And I was talking to my local oncologist about it as well, because he was the one that was treating me. I had to have 3 blood tests a week, blood, platelets, all that stuff. My local oncologist took care of me. And my oncologist at MD Anderson called me. I think it was on a Sunday. I was supposed to go down in a couple days and get my last chemo, and he said, I can't do it. He was afraid that it would kill me. So he took it upon himself to, to stop it. And I went, I asked my local oncologist if I could do maintenance for a couple of years since I couldn't finish my chemo. Because the oncologist at MD Anderson was okay with it. There's no data that doesn't know if it helped or didn't help, or, but I chose to do that. And until a few months ago, I've been on some sort of treatment since 2016.
How did you find support throughout the clinical trial process?
When I was first diagnosed, my daughter went online and found a mantle cell support group on Facebook. Well, when I started going to MD Anderson and meeting these other people that had mantle cell, one of them that I've been to a conference with and everything, her husband was getting treatment the same time as me, and they were spaced the same, so I'd see her quite often, and she started the group. And through that group, you learn the good, you learn the bad, through it all, you can see what other people experience. You can see if something that you're going through, other people have gone through. You can ask questions on there. Hey, I have a rash on my arm, I'm just using that as an example. Has this happened to anyone else? And just a lot of support for each other on those support groups. I think they're wonderful. I would encourage anyone to join one if they're going through cancer or any illness, really. My brother's on a support group. He has prostate cancer. He's on a prostate cancer support group, so they're out there.
What was one thing you were surprised to learn about clinical trials that you didn't know?
I didn't realize all the follow-up, and they'd be following me they're still following me, and you can keep track of the statistics. I don't know them right now, but you can keep track of how many people are still in remission, how many have come out, how many have passed. Um, and we have that support page. You have to have mantle cell lymphoma and go to MD Anderson in order to be on that page. So you hear a lot.
How did you take care of your mental health throughout the clinical trial process?
I didn't do a lot with my mental health at first. And then my local oncologist said you either need to go on antidepressants or go for counseling. And I figured I was on enough medicine, so I went for counseling. The treatment does affect your mood. And I think that's something that's a side effect that's almost out of your control. I would get mad very easily. So I did go on Wellbutrin for a couple of years, and I think that side effect has gone away, I hope. But people did notice, my family did notice a difference when I was on the Wellbutrin, and I just started counseling again.
How has cancer care helped you?
They've helped pay for my portion of the cancer medication that I take, which without the grants, I don't know how people would do it. This year it was $2,000, and Cancer Care paid that for me. They gave me some money to help me with my dog. My dog was sick. My dog has passed away, but uh, you know, even that is a help. And I contacted them just recently to see if they had like transportation or some other kind of help. Um, People with cancer, a lot of people with cancer struggle financially. Like I said, they cut the pay, and then the attorney keeps so much of it when you have to get an attorney, and um, Cancer Care has been a real help to me.
What advice would you give someone who is having a hard time deciding to enroll in a clinical trial?
To do their research um, get multiple opinions, see if the doctor, like especially with mantle cell being rare, making sure that the doctor that you're going with has a lot of experience with the kind of cancer that you do have. And most important, I think, you have to make the decision yourself and do what you think is best for yourself. When you have cancer, you get a million people telling you do this, do that, offering advice, being helpful or trying to be helpful. But when it comes right down to it, I think that the individual with the cancer has to make the final decision, and the people around them have to accept it, to make it, that's the way to make it best for the patient.
Was enrolling in a clinical trial the right decision for you?
I thought about that a lot, especially since my local oncologist thought I didn't make the right choice. But I think it's a question that you'll never know. I mean, how would I have done through the stem cell transplant? I don't know. I know how I did, I couldn't handle the chemo in the clinical trial, but I've been in remission since 2016 or 2017, remission with no relapses. So I can't say it was a bad decision, but since I didn't take the first option, I took the second option. I don't know what would have happened with the first option. So I don't regret, I never regret choosing the clinical trial.